Hi, my name is Dawn Simone, and I will be dissecting a sheep heart and do my best to identify the parts for you. This is the list of the parts that I'm going to identify, and this is our sheep heart right here. This is the superior vena cava. You can see the opening up in here. It's at the top of the heart. I'm pretty sure that's what that is. Over here we have, make sure I have it turned the right way. The right auricle is that flap. Left auricle. Those are attached to the atriums. Left atrium, right ventricle, left ventricle. Let's go ahead and see if we can get this pericardium slit. I'm not sure if this is just fat around the outside, so we're going to just probe it a little bit. See if we can't tell what it is. This is the apex of the heart down here, and the base is actually what we would consider the top. It's hard to tell if some of this is fatty tissue or not, because it really feels like it is. But our pericardium is the tissue that covers the outside of the heart, and I'm going to attempt to separate that so you can actually see it. Okay, hopefully this will do a good job of showing the differences. I don't want to cut too much in there till we can figure out what it is. Okay, and here you can see the distinct chambers. These here are the chordae tendineae. They look like tendons, so it's kind of easy to identify that. And they should be attached to the papillary muscles in here. In between, yeah, it looks like in there. This looks like, let me see if I've got the right one. That's one of the valves. This is another valve. You can see our tissue here. The pericardium is this outside lining. Let's see if I can get it separated to show you. That is your pericardium. And that's the outside lining. And you can really, if you look close, see the different layers that they talk about. Okay. Now let's see if we can't figure out. We've got our papillary muscles in here. That's on the side of these. You can kind of see them a little bit better in there. You see that? Papillary muscles. Chordae tendineae. And they are attached to, this looks like it would have been the tricuspid valve. Before I cut it. Got your superior vena cava, and then somewhere down in here, this is our pulmonary, this is our aorta here, and our pulmonary trunk. Make sure I've got it turned the right way. You've got your aorta, or your atriums up in here, your ventricles down in here, and the same on the other side. Atrium, ventricle. You can really see those cords there. I think I might have cut through some of the muscle. And here is our interventricular septum. And that's what kind of separates both of our ventricles. That's why they call it that. Now, 1, 2, 3, that's our tricuspid. This one over here, trying to find the right valves. It's pretty dense. Does not look exactly like the picture, and I think I might need to cut a little more up in here. So let's do that and see what we can discover. That's your aorta there. And inside it should be the semilunar valves, which I'm assuming is that one right there. Okay, let's see if we can get these veins separated. This one here, let's see if that's the right one. Yes, it goes out through there. You can see that. That right there. Let me see if this is our superior vena cava. Down below it was the inferior vena cava, which I'm not really seeing where the end of it is. Let's see if we can't get some of this tissue pulled off. I think this might even be where our arteries are. Kind of see the little path. I'd like to get a closer look. We've got some serious connective tissue going on here. Underneath should have our arteries. Let's see if we can do this without severing it. Get it out of here. Our pulmonary trunk is in here. I think I may have actually cut some of that. Let me see. That looks like it right there. There's our pulmonary trunk, and coming off of that